Welcome to Rwanda Medical Academy. Signs and symptoms of stroke. Do you know what a stroke is and how to identify its symptoms? What is stroke? A stroke, also known as a cerebrovascular accident, is a violent interruption of blood flow to the brain. This sudden halt can be caused by a blockage in the blood vessels known as an ischemic stroke, or bleeding in the brain, termed a hemorrhagic stroke. Both result in the death of brain cells and can lead to severe, sometimes irreversible damage. Signs and symptoms, remembered as be fast. Mnemonic. Identifying the symptoms of a stroke at the earliest possible stage is crucial. The faster medical professionals can intervene, the higher the chances of minimizing the damage and improving the patient's prognosis. A handy tool to remember these symptoms is the be fast mnemonic. Starting with B for balance. An individual experiencing a stroke may suddenly lose their balance or coordination. They might stumble or have trouble walking straight, which can be a clear sign that something is wrong. E stands for eyes. A person having a stroke may have sudden blurred or double vision. They may also experience persistent trouble with their sight. Any abrupt vision changes should be taken seriously. Moving on to F. This represents face. One of the most recognizable symptoms of a stroke is sudden drooping or numbness on one side of the face. If the person's smile is uneven or lopsided, it's time to take immediate action. A is for arm. A stroke can cause sudden weakness or numbness in one arm or leg. If one arm drifts downward when both are raised, or if one leg seems unsteady, it's another warning sign to heed. S signifies speech. A person suffering a stroke may have sudden difficulty speaking. Their speech may become slurred, or they may be confused and unable to articulate their thoughts clearly. Finally, T stands for time. Time is of the essence when dealing with a stroke. Every second counts. If any of these signs are observed, it's time to call emergency services immediately. If you're in Rwanda, call 912, it's the EMS for Rwanda. In summary, a stroke is a sudden interruption of blood flow to the brain that can lead to severe, potentially irreversible damage. Quick identification and action can make a significant difference in outcome. Remember the be fast mnemonic. B balance, E eyes, F face, A arm, S speech, and T time. These are your keys to recognizing the signs of a stroke and ensuring the best possible outcome. Remember, when it comes to a stroke, every second counts more. Thank you for learning. At Rwanda Medical Academy, knowledge is power and value.